Hi, I'm Sushant and welcome to this online tutorial by Quest. Diabetes mellitus is a leading non-communicable disease, and India is sitting at the epicenter of this epidemic. Diabetes contributes largely to renal disorders like end-stage renal disease. A lot of these patients suffer from cardiovascular morbidity. Blindness is a common complication of diabetes, and a lot of these patients also undergo amputations because of diabetic foot. In this tutorial, let's try to understand how do we define diabetes mellitus and what are the common symptoms of this disease. One of the important concept to understand right up front is diabetes is not one disease. It's a group of disorders. And the common thread which binds together these disorders is a metabolic problem of hyperglycemia or increase in blood sugars. Before we look at how do we define this increase in blood sugar, let's ask a question: which is more dangerous, hypoglycemia or hyperglycemia? Well, if a patient has hypoglycemia, immediately the symptoms would start of palpitation, dizziness, or sometimes frank unconsciousness. In severe hypoglycemia, patients might throw scissors and it might be dangerous to life. But if we think of hyperglycemia, what are the immediate symptoms? Well, very often hyperglycemia is asymptomatic. The question then is, why are we so afraid of hyperglycemia? Why do we call it a disease after all? The answer to that is, if I have hyperglycemia over years, that is going to cause complications. And it is these complications which are the dreaded consequence that I'm afraid of. Therefore, the definition of diabetes is set at that level of sugar which, if chronically present, would lead to these complications. That brings us to the definition of diabetes mellitus. A normal fasting plasma glucose is considered to be less than 100 mg per deciliter. Similarly, a normal postprandial glucose after 2 hours of a glucose load is considered to be less than 140 mg per deciliter. Diabetes is defined as a fasting plasma glucose of more than or equal to 126 mg per deciliter or a postprandial glucose of more than or equal to 200 mg per deciliter. It is these levels that we believe, if they are chronically maintained by a patient, they would lead to complications that we are going to talk of. But there is, you must have realized, a gap between these levels of normal and abnormal. This is what is called as pre-diabetes. These are patients who are at risk of developing diabetes later on in their life, or maybe sometimes at risk of developing some of these complications later in their life. Pre-diabetics are then patients having sugars or fasting sugars more than 100 but less than 126. Similarly, a postprandial glucose of more than 140 but less than 200. These patients need to be under our monitoring. One catch over here is that the sugar levels that we are talking of, they are going to change across the day. And it depends on when I take this sugar sample. There is a possibility that my patient sugar today is normal, but if I don't test it tomorrow, it could have been abnormal. So I need a marker which could tell me what is the sugar control over long term. And that marker is glycosylated hemoglobin or HbA1c. HbA1c tells me what has been the sugar over the lifetime of an RBC, that is over a period of around 3 months. Normal HbA1c is defined as less than 5.6%. But to call it diabetes, HbA1c of more than or equal to 6.5% is taken as diabetes mellitus. Now, let's understand what would be the clinical features of a patient with diabetes. Most patients of diabetes are asymptomatic, and therefore they do not come to our attention quite early. There would be some types of diabetes who might be symptomatic earlier, but for a majority, it's screening which picks up diabetes. When the symptoms start, polyuria, polydipsia, and polyphagia are considered the classical features of diabetes. Polyuria is largely because of the osmotic diuresis that happens when glycosuria begins. A significant patients of diabetes would present because of fatigue. It's important to remember that most patients of diabetes have a predisposition of being obese. But when there is significant diabetes mellitus, patients can present with weight loss as well. This is because due to diabetes, the cells are starving for energy. There is a lot of sugar in the blood, but that's not reaching the cells. So cells, especially muscles, start breaking down protein, and this protein catabolism is responsible for weight loss. Along with fatigue and weight loss, weakness can be a common feature of patients when they present for the first time. Patients can have other features like blurring of vision. which could be either because of edema of the lens or sometimes because of retinopathy. It's common for patients to have superficial infections which are recurrent and difficult to heal. In fact, small wounds might take a very long time to heal, and that might be the first time someone suspects diabetes mellitus. Since most of these patients are asymptomatic, it is reasonable to screen patients for diabetes if the patient is above 45 years of age and has any risk factors for diabetes. With that, let's summarize what we have understood. We have understood that diabetes is a condition of hyperglycemia. It is not one disease, but it is defined by one factor of sugar fasting more than 126 mg per deciliter. We have understood that most patients are not going to be symptomatic, but we can screen these patients if they are especially after 45 years of age. If you have any questions on this, feel free to discuss with me on the Quest app. Thank you and Jai Hind.